So the next question is, what is spinal cord compression? Spinal cord compression is very analogous to cervical spinal stenosis. Now remember, the spinal stenosis is the enclosure of a expected canal or opening in the spine where that aperture gets smaller and smaller over time due to a variety of issues, typically due to degenerative changes and arthritis of the spine, or either the spinal cord or the nerve roots get compressed, symptoms manifest downstream. Spinal cord compression is a radiographic diagnosis, meaning you can see it, and it is defined by the visual of the spinal cord having compression upon it, or pressure, structural pressure. The spinal cord, no different than the brainstem, no different than the brain, the soft tissues of our nervous system, are very compliant structures. They're very soft, blottable, very functional, electrically active soft tissues. So they are able to bow out of the way very asymptomatically, silently in fact, without any symptoms for a significant amount of time and duration. But when they get to a head, things come to a crux, and that pressure builds up so much to where the deformations start to cause symptoms. You can see that, and you'll visualize some structure or entity pushing on the spinal cord and deforming its nice round symmetric shape. Typically that visual, that finding on an imaging study or an MRI, is most relatable to the entities that are described as severe spinal stenosis. Radiographically, when you measure these things out, things are grouped in tiers of 3. 1, 2, 3. 3 is a great number. So the amount of spinal stenosis from 0 to 25% is typically described as a mild stenosis. Patients are mostly asymptomatic. The spinal cord is not being deformed. Moderate stenosis is 25 to 50% loss of that aperture. It's downsized up by half, in fact, and some patients may be developing some symptoms. But the most notable subset of patients where they have the concurrent diagnoses of symptomatic spinal stenosis and spinal cord compression coexisting with myelopathy, cervical myelopathy, is in that subset of severe stenosis, greater than 50% or more. And you'll see that spinal cord start to bow out of the way. Certainly a concern to be discussed with us when these things are diagnosed. We want to see them up front, talk to the patients immediately, and then counsel them on what the next best steps are.